Good morning, everyone. Stacy and I are so excited to welcome everyone here to the former Ionic Ave Boys Club in Worcester, home of the future Creative Hub Community Arts Center. Thank you to UMass Memorial Health Care, the city manager and his hardworking team for being here today and helping to make this partnership possible. Without you all, we wouldn't be where we are now.
We want to give a huge thank you to everyone watching live this morning. We have a great speaking program lined up, and to start it off, I would like to introduce somebody who has been with us since the beginning, showing steadfast support and lending invaluable advice and an ear as we continue to move forward in this project. So please welcome our city manager, Augustus.
Well, good morning, everyone, and let me just say especially thank you to Laura and Stacy for their vision, which is really what's bringing us here today, which is their vision to take this amazing building, which had become kind of an eyesore in the neighborhood. It was closed, boarded up, and it wasn't really adding to the vitality that we're looking for in the city of Worcester and in the Main South neighborhood. And they had this vision to create a vital building that was going to bring people to it day and night, during the week and on weekends, to create art, to create connections, to create community. And that's what this space is really all about. For many, many years, this building was vibrant with kids and staff coming in and out, creating connections, and you bump into people all over the community who have great memories of the Ionic Ave Boys Club and all the friendships and the relationships that they made in this building. And I really see that this is going to be a similar type of facility in the decades to come, a place where kids and community are going to talk about the amazing connections and relationships and experiences that form them and influence their lives in this community. This, like every project that we've ever done in the city, is made up of a lot of different moving parts. It's never one piece of funding that allows a building like this to come back into positive use. It's a lot of creative funding strategies that are cobbled together in order to move a project forward. You know, one of the things I really want to highlight is we talk about this renaissance that's been going on in Worcester over the last 10 years or so. The secret sauce to that renaissance is the arts, the creative community, whether it be powwow, whether it be our increased amount of public art. The arts and all that they represent is really the secret sauce that is part of what's fueling this renaissance in the city of Worcester. So this creative hub is going to be another important catalyst to that fuel that is driving this renaissance here in the city of Worcester. That's why I was so excited about it when Laura and Stacy first kind of presented this vision, this idea, and I said, look, sign us up. The city of Worcester is all in. We want to do everything we can to make this happen. And luckily, in the city of Worcester, we have anchor institutions like UMass Memorial Health Care. Not only are they the largest employer here in our city and in our region, but you think about this corona pandemic that we're still dealing with. I can't even imagine us as a city trying to deal with that situation and keep our community safe and healthy through that pandemic without UMass Memorial and the amazing leadership that Eric Dickson and Doug Brown, Cheryl Arpiori, and the entire team at UMass Memorial have provided to our community, the advice, the guidance, and the partnership that they've provided is such an important part of why Worcester has been able to, I think, very successfully gotten to this point in the virus and will continue to partner with us until a vaccine is found. But they're also a huge community partner, even in non-direct healthcare ways. As a large employer and as an anchor institution, they're willing to use their dollars creatively to leverage other benefits to the community. We know the social determinants of health are critically important to the outcomes of the health of our community, and creating the jobs that are going to be created with this facility, creating a positive environment in this neighborhood that really needs these kind of opportunities, whether it be after-school programming or other activities that are going to be able to happen here. UMass Memorial is such a progressive organization. They get the idea that investments in places like this and investments in neighborhoods like this directly benefit the health outcomes of our community. And we're lucky to have that kind of progressive leadership at UMass Memorial. So to me, it's a great day when I see two great entities come together and create something even stronger and even more impactful for our community. And that's what we have today with the Creative Hub team and with UMass Memorial Health Care. Maine South is better. The arts community in Worcester is better. Programming for our youth and disadvantaged communities is better. And the city of Worcester is better because of this partnership and because of this relationship. So on behalf of the city of Worcester, I just want to say thank you to UMass Memorial. Thank you to Laura and Stacy and the whole Creative Hub team for bringing this partnership to fruition today. Thank you.
Thank you, City Manager. And now I would like to introduce President and CEO of UMass Memorial Health Care, Dr. Eric Dickson.
Thank you, everyone, for being here today, and for City Manager for your nice comments, and Laura and Stacy for the incredible work that you're doing here. At UMass Memorial Health Care, our mission is to improve the health of the diverse populations of central Massachusetts. We do that in our hospitals, we do that in our clinics, we do that in our Dixon treatment centers at Community Health Link. We do that at community testing events for coronavirus, which are going on around the city as we speak. But increasingly, we've recognized that we have to do more than just deliver good medical care if we want to really improve the health of the population in this region. We have to invest in putting jobs into places where people are living in poverty. We have to invest in buildings that can revitalize an area, creating jobs and unleashing the creative power that exists in all of us and the healing power of the arts. And so for the past 2 years, we've started to make investments in this city and others to try to improve the health of the population through addressing the social determinants, which have as great an impact on the overall health of a population as does the medical care in the region. This project, this is health to me. When I see the beautiful place that people are going to be able to come, the events that could be occurring here in a part of the city that really needs some help, this is what we are committed to doing, in addition to providing great care to the patients that we serve. It would not happen without the leaders of our Anchor Mission Task Force, and especially Doug Brown, who's led this effort for us, Cheryl and Kate and the rest of the team. Can't thank you enough for the work that you've done, and thank you so much for allowing us to be a part of this wonderful project.
All right, thank you, Dr. Dickson. Now I would like to introduce the CAO of UMass Memorial Health Care, President of Community Hospitals, and according to Kate Bean, one of the kindest humans on planet Earth, Doug Brown.
Thank you, Kate Bean, my publicist. It's great to be up here this morning. Our caregivers at UMass Memorial work tirelessly every day to heal our patients, as Dr. Dickson said. But what we know is that the health care we provide contributes only about 20% to the overall health of an individual. A far greater contributor, about 3 times as much, is what we call the conditions or circumstances of one's life. The social determinants of health are things like income level, education and employment level, housing situation, and access to healthy food. And unfortunately, when we look outside our walls, what we see is great disparity in the conditions of people's lives right here in Worcester. And that has a huge impact on health. We know, for example, that about 1.5 miles from here on the west side, there's a neighborhood with a life expectancy of 84 years. And yet, if you grow up right in this neighborhood, you're expected to live only 78 years, 6-year difference in 1.5 miles. If you grow up in Kelly Square, you're expected to live 73 years, 11-year difference. That's lower than some of the third world countries. In order to address these unconscionable discrepancies in our community, we have decided at UMass Memorial to double down on our mission and be just as tireless in pursuing the healing of our community as we are in the healing of our patients. And that's why we are here today. We have taken $500,000 from our investment portfolio, and instead of investing in stocks and bonds, we are investing in Laura and Stacy. And we think they're a fantastic investment, by the way. Arts programming, physical activity, revitalization of a neighborhood, and the creation of a gathering place are all things we know improve physical and mental health and improve lives. We cannot think of a better way to spend our money to help make sure that all parts of our community thrive. A number of thank yous. First, to our enlightened city manager. We think the best in the country. Thank you, Mr. Augustus. I also want to thank Bob Feldman and Kate Behan, who have chaired our investment committee and helped us get to this decision. Monica Lowell and Kim Reckart and Cheryl Prior are true champions in the community. And of course, Rick Segrist, who's the chair of our board, and Eric Dixon, our CEO, for their leadership in helping to make this happen. In closing, let me just make an appeal to the other great organizations in our community who have the capacity to do what we did. Please join us. If others agree to take 1% of their investment portfolio like we have, it will result in tens of millions of dollars invested in this community. Invest in the Creative Hub and many other projects that are making a difference. I know that you will find, like we have, that it may just be the best decision to make. Thank you.
Thank you, Doug Brown. 5 years ago, thanks to the City of Worcester Economic Development Office and the Cultural Coalition, Laura and I toured this beautiful building with a vision and a hope. A vision to expand the arts community here in Worcester and to bring about a stronger awareness around the important role that arts and creativity plays in the development of healthy and thriving communities. Now, 5 years into our journey, with the Arts and Business Council as a development partner, and folks like UMass Memorial Health Care as a vital participant in this endeavor, we are extremely close to realizing our vision. Creative Hub continues to support the Worcester community through programs such as our exhibition series, which focuses on showcasing the talent of artists whose voices may not otherwise be heard. We will also be reopening our after-school program on Main Street, just in the Berwick building, so we can be operational during school hours for families who will need childcare during remote learning. Additionally, during the height of the pandemic, with the help of some of our local partners, we were able to deliver over 50 art kits to local youth who did not have access to creative supplies at home.
Now more than ever, the arts are desperately needed. Arts will play an absolutely crucial role in rebuilding our communities as we recover from these unprecedented times. This art center will be for children that haven't been able to attend school in months and see their friends. It will be for families that are struggling to make ends meet. It will be for individuals who may be single and they've been isolated and lonely. It will be for folks battling mental illness and other health conditions. It'll be a space for everyone to find joy, empowerment, and community. Activities like learning to salsa dance for the very first time, listening to your favorite type of music live, painting when you've never picked up a brush in your life, or zoning out and watching a spectacular performance. All of these types of creative experiences bring us closer to an understanding of self and closer to realizing our collective responsibilities as a society. And that's why we believe that art heals and that art changes lives. So once again, in closing, we want to give a huge thank you to UMass Memorial for their support in this project and for believing in the importance of arts and culture in the role of healthcare and in creating and sustaining healthy communities. Thank you, everyone.
Thank you.